Hello, everyone. My apologies for not being able to attend this meeting in person. However, thanks for the opportunity to give my presentation offline. My name is Mesut Kocaman. I am a health economist working at J&J MedTech. In addition to my traditional health economics responsibilities, particularly over the last 5 years, my work has focused on researching sustainability in close collaboration with clinicians and environmental scientists. Today, I will share my experience on this topic with key findings from our published research. As you know, globally, healthcare is responsible for nearly 5% of greenhouse gas emissions, which is a huge amount. On the other hand, the WHO's disease burden report indicates that 23% of global deaths are linked to the environmental factors, such as climate change, air pollution, and water quality. So there's an interconnection between human health and the environment. Therefore, several key institutions and studies have proposed expanding the definition of value in healthcare to include environmental impact. So the primary focus should always remain on achieving best possible patient outcomes. However, it's also important to improve the triple bottom line by minimizing environmental, social, and financial impact, ultimately maximizing the value. This topic was also highlighted at last year's MedTech Europe Value-Based Procurement Conference in Brussels. MedTech Europe collaborated with academics on this issue who shared their perspectives, emphasizing that there is a strong correlation between value-based healthcare and sustainability. So the importance of reducing low-value activities is highlighted, and the industry is urged not only to focus on its carbon footprint, but also to collaborate with health systems to maximize value and reduce associated environmental impact. I particularly like this quote from value-based healthcare professor Hamish. So from an environmental perspective, the best product is the one that is not used. Because every avoidable appointment, every avoidable procedure wastes a significant amount of carbon. So the key is to reduce all low-value activities that waste resources and cause environmental damage. The question is, how can healthcare reduce its environmental impact while continuing to improve patient outcomes, to improve value? Professor Surgeon Mahmoud Butta, the lead author of the Green Surgery Report, presented key findings at this year's Sustainability Conference, highlighting three main strategies to reduce the environmental impact of healthcare, particularly surgical care. Reduce, reuse, recycle. He emphasized that avoiding surgery entirely reduces its environmental impact by 100%, as the most sustainable surgery is the one that never happens. If avoidance or reduction is not possible, reusing materials can reduce the impact by up to 56%. If reuse is not feasible, recycling is the next best option. The question is, how can the reduction strategy, the most impactful one, be achieved? Here is the answer. A study published by surgeons suggests that the reduce principle, the most impactful one, can be achieved by reducing surgical complications rate. Because surgical complications lead to significant healthcare resource use, which contributes to environmental impact. However, the environmental impact of surgical complications had not been measured in the literature. That's why we are taking a care pathway approach by looking at the full environmental footprint of treating a complication. including the use of our products, so we better understand the social and environmental impacts of medical innovations and intervention. So by focusing on care pathways, we increase the opportunities to reduce and prevent complications, burden, and avoidable demands on health system. In turn, reducing the operational pressures on medtech supply chains. This helps to ensure we balance the clinical, economic, and environmental outcomes for patient care. So using the care pathway approach, we generated evidence on the environmental impact of surgical complication, specifically surgical site infections and colorectal anastomotic leaks. So these two studies published in peer-reviewed surgery journals, and they are the result of a collaboration among diverse healthcare stakeholders, surgeons from Switzerland and the UK, public health leaders and sustainability experts from the Sustainable Healthcare Coalition, environmental scientists from the ERM group, and health economists and medical affairs experts from J&J MedTech. I will now briefly share key findings from this research. So, anastomotic leaks are a common complication of colorectal surgery. This occurs when the two ends of a channel that have been connected together do not seal completely, so allowing the contents to leak out. We published this study at the end of last year. So in this study, as J&J team, we collaborated with colorectal surgeons, sustainability expert, key opinion leaders, and environmental scientists. So this study assessed the environmental impact of anastomotic leaks using a care pathway approach. So as you can see in the figure on the right, by developing care pathway, we identified the typical activities involved in the diagnosis and the treatment process. So these included steps such as CT scans, blood tests, antibiotics, additional procedures, reoperations, and additional hospital stays, all of which require extra hospital resources to treat this complication. And then we assess the environmental impact of each care pathway activity in terms of climate, water, and waste. This assessment allowed us to calculate the environmental impact of an anastomotic leak. So we found that a single leak can result in 1,303 kilogram of CO2 emissions, which is equivalent to the carbon emission of 5 flights between London and Rome. This is the climate impact of just one anastomotic leak. It's substantial, isn't it? And similarly, one anastomotic leak leads to 1,800 cubic meter of water use and 123 kilogram of waste. We also presented this study at scientific conferences like ESCP in Europe and SAGES in the US, as well as surgery summits such as the European Colorectal Surgery Summit in Amsterdam and the MedTech Europe Value-Based Procurement Conference meetings. And these aim to raise environmental awareness about the environmental burden of anastomotic leaks. Feedback from the clinical and non-clinical stakeholders has been excellent, as the sustainability narrative around surgical complication resonated strongly with surgeons. Another example comes from the UK, where the environmental impact of reducing surgical site infections was for the first time considered by the NICE during a health technology assessment. So plus features were reviewed by the NICE, which is the UK's health technology assessment agency, as part of the medical technologies guidance. So these marked the first time where clinical, economic, and environmental factors were all evaluated together as part of a medical technologies guidance for plus sutures. We quantified how reducing surgical site infection with the use of plus sutures can reduce environmental impact. And as a result, the medical technologies guidance indicated that by reducing surgical site infection risk using plus sutures leads to environmental benefit. And similar to the UK health technology assessment process, environmental impacts have been incorporated into health technology assessment and tendering and value-based procurement processes in many countries across Europe. So in conclusion, while the primary goal of reducing surgical complications is patient safety and improved clinical outcomes, it's essential to recognize that these efforts can also provide environmental benefit. So these studies show that reducing complications represent a true win-win scenario benefiting both patients and the planet. Additionally, it's also important to highlight the integration of environmental sustainability into value-based healthcare by identifying evidence-based best practices that bring environmental stewardship into the healthcare quality conversation. And I believe these studies that I presented offer a methodological framework for evaluating the environmental impact of healthcare activities. Thank you very much for listening, and I wish you a great rest of the meeting.